Good morning, and thank you very much for joining us. I am Yori Folari. My guest this morning is Dr. Ronke Agoro. Dr. Ronke Agoro, welcome.
Thank you.
Dr. Ronke Agoro is a public health practitioner in the Emergency Operations Center of Lagos State, and particularly the team, but I think they call it a pillar of the social mobilization and risk communications. Did I get all that right?
Yes, you did.
So thank you very much for coming on.
Thank you for having me.
We need to sort of understand what a bit better what Lagos State is going through. There's been a lockdown, as announced by the governor.
Yes.
It's not exactly a blanket lockdown, is it?
Yes.
But it's like it's enough for the moment.
Yes.
Could you explain that a bit? Because if not everybody is under this lockdown advisory, are we still safe?
We're as safe can be. The partial lockdown there's a science behind it. And I believe every other person might have heard of flattening the curve. The science behind this is to stop transmission. If people are not moving around, the chances of the spread of the disease, or the virus, I should say, is reduced dramatically. So that alone gives us a different level of safety. So it's increasing how safe we are. Once we are able to do that, you reduce one person infecting 1,000 or thereabouts. And once you can get that numbers down, you actually are on your way to flattening the curve and actually, making it disappear.
In introducing you, I spoke about social mobilization and risk communication. And I wanted to mention in that context that I introduced you as Dr. Ronke Agoro,
Yes.
which indeed is correct.
Yes.
But I think I should also point out that you're not a medical doctor.
No, I'm not.
You don't do anything clinical.
No, I don't.
You're a public health practitioner.
Yes.
In other words, you're an expert. You're one of the experts and researchers and medical doctors that really can speak to us about this.
Yes.
What are the numbers that Lagos has at the moment?
Currently, as of the last time I checked, it was 30. Lagos State has had the opportunity and the privilege to have 2 of the patients discharged, and we have no deaths currently. So that's, of all the people we've tested, 30 have been confirmed. That's what the status is right now. I can get up from here and it would have changed because we're testing all the time. So if test results came out in the next 10 minutes or an hour ago, then it would change. But right now that I know, it's 30.
I believe, well, we've been speaking for a while, so I'm not too, I don't remember if you said it since coming on air. As safe can be in the circumstances. Nobody has the ideal situation, nowhere
Yes.
in the world. That's what we've been hearing from
Yes.
America to Casablanca,
Yes.
right up to here. But still, people want to know that we have this under control,
Yes.
which I understand is a delicate phraseology when,
Yes.
especially with the professionals, when you
Yes.
talk about having it under control. Could you explain all of that? Because people would like to be assured.
Under control means we're working non-stop. It means that we're not sitting down and just fooling around. Every officer that is involved, Mr. Governor himself, the commissioner, all the PSCs, everybody, all hands on deck. We're doing everything we can. Information, the situation is changing globally every minute. I take that back, every second. So what we have under control is that we're working. There's no, I think what you might be asking, or the public might be seeking, might be an illusion, because if we say we have everything under control, then I should be in my bed sleeping, and so should be the governor and everybody really. But what it means is that we're working nonstop. I mean, I can't remember the last time I was at home doing nothing, even working into the night and all that. So is Mr. Governor. Everybody we're on our toes. I mean, if there's anything more than that, making sure that information that we get, if it's useful, we're using it to make sure that we keep everybody calm, including ourselves. So that's the truth of the matter, that we're not just sitting around doing nothing. That's what under control means.
Just before we continue, let's revisit Governor Sanwo-Olu's address yesterday, and we'll come back to studio.
Okay.
Governor of Lagos State Babajide Sanwo-Olu at the press briefing on COVID-19 pandemic after a meeting with heads of security agencies in the state. Governor Sanwo-Olu announced new measures needed to be adhered to by residents of the city. He said public parks in private and residential estates, swimming pools, gyms, beauty salons and other public places should shut down until further notice.
If you do not have a need or a reason to leave your location, please stay at home. That's the best that you can do for your family, for yourself, and for us to ensure that we can do the job and do it well. So, and that's why we're extending the coverage of the lockdown from Thursday 26th, like I said, to all markets, but except the ones that I've given exceptions to, that are selling food and essential household materials and medical equipment that we might need to restock or we might need to deal with.
The State Commissioner for Health, Professor Akin Abayomi, says the state has the capacity to do molecular tests, which is 100% accurate, unlike the rapid test kit in circulation. Yaba Mainland Hospital, the Lagos University Teaching Hospital, and the Nigerian Institute of Medical Research have this facility.
It's not airborne, it is droplet-borne. So if I sneeze, it will remain in the air for a few seconds until the droplets fall to the ground. It does not remain suspended in the air. So in precise definition, it is not airborne, it is rather droplet-borne, and it remains active on some surfaces for a few hours.
The national leader of the ruling All Progressive Congress APC, Asiwaju Bola Tinubu, reiterated the need for people to cultivate the habit of social distancing to curb the spread of coronavirus.
In addition to the appeal of the governor for you to continue and bus stops and various environments, maintain distance from one another, stop the handshake, do what is necessary to protect the citizens.
Though there are about 1,800 persons to still be contacted to ensure that the coronavirus disease is actually contained in Lagos State. The Lagos State government is yet to announce a total lockdown of the state because of some economic implication. But the truth remains that social distancing and personal hygiene needs to be adhered to at this point to contain the disease. Sharon Ijason, TVC News, Lagos.
Okay, thank you very much, Sharon. So back in studio with Dr. Ronke Aguro, public health practitioner in Lagos State. There's so many things that people have to bear in mind. To keep it very, very simple, people have talked about personal hygiene, wash your hands, and wash your hands on again. Then there's this whole matter of social distancing.
Yes.
Distancing. Is that going to be something of a challenge? Because people can understand it. Doctors are advising 6 feet. 2 meters, 6 feet, thereabouts, and that kind of thing. Whereas I understand it's crucial, but how practicable is that in the confined spaces that sometimes one has to find oneself, like in public transport, like in danfos?
I believe that's a challenge anywhere in the world, really, because this is a break from the norm, from the way you and me know how to live our lives. A year ago, it was a different story. So it's not going to be done overnight. That's a given. However, ringing it into people's ears day in, day out will trigger the behavior. I was reading something online about New York City, which is like we can compare in terms of population. And this time last year, the number of people that went on New York subway was 5 million plus. A year later, it was 1 million. 1 million is still a lot, but the difference is drastic, it's huge. That alone drives down the impact or the opportunity of a virus spreading. That's a huge difference. I mean, if you want to go into the nitty-gritty of it, let's say one person can spread the disease, the virus, by 1 person to 1,200, like the case in South Korea, case 31. you do the math, I don't think our calculators can accommodate it. So that alone, reduces risk dramatically. Are we going to be able to say, oh, everybody's saying, well, we'll wait and see. The government is taking the decision as the need arises, but cutting down by at least 50 to 60 or 70%?
It's better, much better than nothing.
Yes. Oh, yes.
Now, people are listening to experts speak. Some of them are also, unfortunately, for the moment, also taking counsel from wherever they can get it. There are all sorts of myths that are being, people are busting myths. People also want to help themselves. We've heard about all sorts of things. That is because so little is known of this virus in terms of how to combat it. But what people are doing, we're talking about panic buying everything in sight that's, it seems, remotely medical, buying hand sanitizers, buying out the stores, face masks. And let's talk about face masks. You see that a lot. What is the expert's viewpoint on face masks? Are they any use?
Yes, they are. There are different grades of masks.
There you go.
The idea is, the recommendation is that if you're coughing, you should use a mask so that you don't spread, like the commissioner said, droplets in the air and all that. One. If you're taking care of someone that you suspect has any of the, like a cold or something, you could wear a mask. If you're susceptible to certain things, some are susceptible to soot in the air, dust. I am to dust because I don't want to trigger whatever. Because this is, like you said, it's a new virus. How anybody's going to react to it, we're all learning. It's evolving. But we've seen some patterns that we might be able to use to model how the average person would react to it and all that. So there are certain reasons that the mask should be worn. And I've just listed them. If we can all adhere to it, but the human nature in us is making every other person wear it. And
you've just said, I think, that not all masks are the same.
They're not. I mean, what professionals use is different from what you see. And it's, like I said, it's evolving.
Better be safe than sorry. And as you've explained about the droplets, you don't want to spread that.
Yes, especially if you're coughing or sneezing.
Especially if you are coughing and if you're sneezing.
Or taking care of someone that is a bit poorly,
Okay. So we have this situation, we're being told not to panic. Worrying news sometimes. We've heard that the chief of staff to the president, has, indeed been diagnosed with this condition with COVID-19, haven't been infected with COVID-19. There is something of a scare because meetings with the entire executive council, I don't know, rumors all over the place. So that is not a rumor, that's a fact. But then there are also some rumors that in Lagos State, some big men, the directors, had taken a holiday abroad, had come in, and there are panic, at least simmering panic as to some people had come in back into the secretariat and had continued as normal, and there are fears that might they spread anything? Now, Doctor, you probably know. Is this one of those rumors, or is there anything to it?
The directive from the federal and the state is that if you've come back into the country from any of the high-risk nations, actually the whole world is a risk nation right now.
Right now.
All the countries in the world are risk nations. You should self-isolate. Like the commissioner said, it's not an airborne disease. Science is still, evolving. An hour from now, WHO or any of the international organizations, oh yeah, by the way, it is an airborne disease because it's evolving. It's new. I mean, this disease didn't exist 6 months ago, so we're finding out as we go along. If everybody takes responsibility for what they're supposed to do, you've just come back into the country, you're staying away from people to the best of your ability, and you're staying away for 14 days to see if you develop anything. Don't forget the incubation period is just about that time. So if you don't develop anything, then that means give or take, because now it's a situation of give or take that you probably don't have anything. But at least those 14 days, it would reduce the number of people you are exposing, should you have anything. So, because if somebody doesn't keep away, and you now go out shaking everybody,
Continuing, carrying on as usual.
like I said, let's do one person to 1,200.
So is there anything at all to the phantom, the rumor that I spoke about, circulating underground about Lagos State, the Secretariat?
About legacy, well, I know of a director or two who flew out and just came back. They haven't come to the office. That's that one I do know.
Okay, that's what
they are
you know.
available online. I just spoke with one before I came on now. I don't cover the entire secretariat, so I can't really respond. But I know the governor and the entire ESCO has been very responsible. I can say that for a fact and say, if you've just come back, please stay away. Just everything else technically can wait. Health is a commodity that we all share. It's personal, and at the same time, it's a common denominator for everybody. So I'd rather your work stall. I'm talking as a person now, and I believe that's the stand of the governor as well. I'd rather your work stall than you come and infect everybody. It's more expensive at the long goal, because if one person is down and it's just that person, or let's say the worst case scenario, the person is in contact with 2 or 3 people. That's a long shot from 1,200. Then you'll be exhausting limited resources when we have to contact trace 1,200 people in comparison to 4. Those resources could be used where it's most needed.
I guess all of us have to take care of ourselves as
Correct.
we include. But are there any that are more vulnerable and especially need to take care?
Yes. If you have any underlying ailment, like colleagues have said, like high blood pressure, diabetes, in my own opinion, we all are.
Okay.
But definitely more, certain people are more at risk. Older people, definitely.
Okay.
This morning,
especially the age factor is what I was getting at.
Oh, yeah, the age factor, and it's not a joke. I saw my parents this morning, and trust me, I was well 3 meters away. I couldn't even go in for the first time in my life to say hello to my parents. My dad is 88, my mom is almost 85. I said, like, really? I said, I can't, because I don't know. I mean, I don't have it to the best of my knowledge, but I can't. We can't afford if anything happens to you.
So you can't really be too careful, and you can't take this as a joke.
No, not by a long shot.
People can't take this as a joke.
No.
It might seem on the outrageous side, ordinarily speaking, but this is no ordinary thing.
Yes. You know why it might be a bit difficult? The world, and this is not just Nigeria or Lagos, the world was expecting to see a giant or a dinosaur or a Godzilla to fight with all the ammunition in the world and say, yes, we're going, activate the army or whatever. But we're fighting something we can't see. So that makes it a little bit beyond the common person's reasoning that I can't see it, so, what are you talking about?
I was listening to a medical doctor, online, and I'd like you to comment that what they would prefer is to not come to the hospital yourself, because he spoke about the hospital is actually the most dangerous place in terms of picking up an infection.
Yes.
And that was a statement that really surprised me, but thinking about it for a moment, yeah.
Yes.
He said, the hospital, we don't want you to come to the hospital. Isolate, as you just said,
Yes.
and then call
Yes.
in, and then arrangements would be made. Don't do what might seem the logical thing of, I'm just going to go to the hospital for a checkup. No.
Yes.
Can you speak about that, please?
Yes, the reason behind that is that if you turn out to be positive, if you go to the hospital and you're positive, like I said, that means we have to figure out who you've been in contact with and trace it back to 0. That's a lot of time. That's a lot of work. That's a lot of money. That's a lot of everything. We're trying to conserve and use...
But if you're at home and you call in, then they will come to you.
Yes, because in suits that will protect everybody.
Okay.
And that way we know that, okay, this is what... But that's evolving too. Things are changing and we're moving as things change. But the ideal is to call if you have symptoms, not prank calls. If you have symptoms, you feel funny, you've been exposed, you've come back from a country any country really, and you've developed symptoms and all that, and this is what is going on with you, you started noticing some difference, and yes, call, and a team will come and take samples if they deem you fit, because then you go through a second screening, because some people have allergies. Allergies are not a common cold. There's still the regular flu that you and me know and all that.
Yeah.
So those have to be weeded out before we run tests. And that's the fact.
Yeah, so you don't show up at the hospital with what are just regular, shall we say, flus, overburdening the system.
Exactly.
Oh, you know, I guess one should keep that in mind. Now, the governor, no, it's not the governor. It was the professor, the commissioner in Lagos State. He was speaking about rapid kits.
Yes.
Now, things are changing. We hear that the kits that are available are not necessarily foolproof, and you have said that it's an evolving situation. It's up there in the air, and so this is a problem. If those kits are not as reliable as doctors would have wanted them to be, and they found this out through experience, might people indeed be quote unquote passing the test, but actually not have passed the test?
And we've been very careful about that. We've gotten so many letters, applications, people calling, private organization wanting to donate and all that. And we're like, okay, hold on, there's a difference. Even WHO is now beginning to write guidelines to ensure that, don't forget that coronavirus, at least I've had a form of it in the form of cold, the flu and all that. So the tests, except they were developed in the last 2 months where COVID-19 evolved, if it was developed before then, we have to be careful, because people could start testing false positive or false negative, because the coronavirus is a family. COVID-19 is one of the children, if I may say, of coronavirus. So we can't just run tests. This is not a pregnancy test or what you call malaria test. Otherwise, we would have a different issue on our hands when we're saying positive is negative, negative is positive. Like the commissioner said, Professor Abayomi said that we're doing molecular testing. It takes more time than what a kit would do. It's not kits we're using reagents in the lab. It's not as fast as we want it to be, that's a fact. The kits are evolving. You know, over the last couple of weeks, some countries have been developing kits because they understand the virus a lot better than when it first came out in December, January, even in February. So scientists are running round the clock to make sure that they can, you know, make it less cumbersome. Until we have something that guarantees that the sensitivity and the accuracy of it is almost 99%.
Okay, I've got to go on a break in another 60 seconds or so, and maybe I should just go on the break, you know, so we'll come back and I won't be interrupted. So stay with us, please. We'll be right back, and we'll take your calls as well. Okay, welcome back. We're with Dr. Ronke Agoro, public health practitioner in Lagos. And, you know, I did point out she's a PhD, not a medical doctor, so you won't see a stethoscope around her neck. But she's one of the experts, and this is the class of people that we really want to be hearing from, the medical doctors, the experts, the researchers. And thank you for coming on, Dr. Agoro.
Thank you.
Information is everything, actually, especially in a case like this. Sometimes we have too much information, and a lot of it is junk, you know. And I notice also that on social media, one of the coping mechanisms are all these memes and all these jokes and all of that. There's a lot of that, and I've worked out that it must be some sort of a coping mechanism, because this is dead serious.
Yes.
This is dead serious. Now, in terms of sharing information, how well are we doing, number one, locally? That is to say, Lagos is seen as being on the cutting edge of things like this.
Yes.
We remember our Ebola experience. Lagos got commendation from, you know, the federal and everywhere, just about everywhere. Now, this time around, is it the same? Are we sharing what we have in Lagos with everybody, so that no matter how far away you are from Lagos, where Lagos is at is where everybody else is at in terms of knowledge?
I believe personally in one philosophy, there's no fun in not sharing. Lagos State is doing that. Every state is our sister, brother state. So, and everything directly or indirectly affects Lagos State. So if we say we're not sharing, we're arming ourselves. States have come in to see what we have, to model what we have, to get expertise and all that. And that's the beauty of science, because you can't have it in, it's not one of the things that belongs in isolation, really. It's for sharing, because the life you might be saving might be yours. So we're sharing with everybody, because everybody's sharing with us. I mean, people that have advanced knowledge of this issue, they've come on board to say, how can we help? So it's a sharing mechanism right now. I mean, in every human dynamics, you'll find few things here and there, but the bulk of it, I can say that without a doubt in my mind, 95%, 99%, we're sharing.
But people don't feel that we're now moving on to the global scale, and they might not have any evidence to back up their particular suspicion, but there is a feeling that perhaps China isn't sharing all that it has. What with the supremacy between the world powers and who wants to be a world power, is there anything to that?
I honestly couldn't tell you. That's a different dynamics from my job. That's global politics. For whatever reason, like I said while we were on break, I believe it's a test for humanity. This is not a test for Lagos State. It's not a test for Nigeria. It's not a test for United States. It's a test for every nation on the face of the earth. So politics, I think it might be more of miscommunication. That's what I want to believe anyway, than to dabble into it being somebody being funny or some country being funny and playing politics. I believe miscommunication and not understanding reasons behind certain things would definitely make anybody feel like that.
Okay. Going back to Lagos shutting down, and Lagos isn't the only state that has shut down. Yes. Kaduna has also shut down. The federal authorities have indeed said Lagos and Abuja will be on shutdown, and we have our implementation. It's not a total shutdown, as you've said before, yes, earlier. People are now, how long might this well last? Because yesterday it was encouraging. We had people from all over the country that could reach us by phone. Virtually 98% of them were saying to shut down is the thing to do, yes, and the sooner we do it, the better.
Yes.
You'd agree with that,
yes,
even though there are humongous challenges.
Yes.
What are we going to eat for all of that time? And how organized are we, or is that are we overthinking it? Do you think?
From the perspective of my profession, no, we're not, because yes, there's that worry. What are we going to eat and all that? Don't forget, technically, you have to be healthy to really eat. That's the truth. Like I said earlier, health is a commodity that you and me have personally, and then it's a common denominator for everybody. Yes, that's a foregone conclusion and worry for anybody, including myself and every other person, really. But if you're not well, food would mean nothing to you. So it becomes, is health more important than food? Well, I stand down on answering that question, and I'll let the public make that decision themselves. But I know every other person that has been poorly at some point in time, be it malaria, be it whatever. You can go without eating, even if you see the food right in front of you. So what are we talking about? Health is not open for negotiation. That's what I say.
Okay.
It's not.
Okay. Sort of crisscrossing this, because as you were speaking, my mind just flashed to what you said. You saw your parents, they're in their 80s, and for you can't even remember how far back, you couldn't actually hug your mother, you couldn't go in there, you maintained, yes, the social distancing, yes, recommendation.
Yes, I did.
And with our senior citizens, in fact, there was some a bit radical. I think someone describing himself as the Israeli defense minister, actually saying on social media, I don't know if it was real or not, actually saying that the elderly, people should just leave their food for them at the door and then withdraw if they have to go to that extent. Do not go in. That wasn't
No, it
ultra
wasn't.
radical?
No, it wasn't.
Oh dear.
Don't forget that I'm thankful that I have parents that old and all that. They're frail already. And then you want to give them something, God forbid, more complicated that we, the younger ones, are learning to deal with? Really? No. Prevention is better than cure any day, anytime. And that science is yet to be proven wrong. So leaving them the way they are, within their own confined space, is better than exposing them to what we don't even know how to treat just yet.
So all these, we're a very social people. So visiting, I just said I'd check up on you, how are you doing? These are the things you're firmly shaking your head.
Yes, I am. I told the security guard, do not let anybody in. It's not that important. My mom called me the other day and was saying that, oh, I have a posthumous award for my sister who passed away sometime last year, I believe. I'm like, do you want to go and join her? It's the truth, because whatever it costs to keep them alive, if the eventuality happens, is not something that I can afford. It's not something they can afford, because it's collective resources that would have to come and face them. Then we'll now start finding out a lot of things that we don't even have any business knowing.
Okay. Mr. Lashupo is on the line from Ladipo. Good morning, sir. Thank you for calling in. Okay, I hear Mr. Lashupo has gone. You can please call in. I think it's very important, bearing in mind the way we are as human beings. It's a human condition all over the world. We're social. We're used to. We've been used to things that. So we're now having to relearn, and we learn very, very fast to adjust behavior that has become almost second nature. Yeah. For instance, I do that a lot, and now I'm hearing from experts, keep your hands away from your face. Yes. You subconsciously go to it, and we're having to learn that. Yes. There are a lot of things that we're doing, and you were just speaking about the most, I don't know how to put it, the most, you just want to care for your people. And there you are saying that we love our people to bits, but the way to love them is to not go near them.
Correct.
Right now.
Correct.
Mazi Okoroafo Arochukwu, good morning, sir. Mazi Okoroafo, good morning. It's going to be like that again now. Well, if it's like yesterday, we will be getting in touch. But Mazi Okoroafo, we're waiting for you. Okay, so that coupled with social distancing. Yes. There are challenges that people are trying to grapple with, the way we live, for instance. And there are so many categories of it. There are what we call the face me, I face you kind of houses. Yes. That's on one level. Yeah. So whether people like it or not, how are we going to know the right thing? I know we have to be sensible. Yeah. Mazi, are you there now? Good morning, Mazi.
Yeah, I'm here.
Oh, great. Morning, Mazi.
I'm hearing you.
Okay, go ahead, please.
Good morning, Mr. Henry. Good morning, doctor in the studio. Now, what I want to find out is this. The government said there should be no two passengers in front of the seat.
Government said we shouldn't do what?
Excess luggage. Now, what is your concern? That this is the job of the VIOs. It's not a question of bringing in police into this. Because if you come down east, west, you see what is happening down there. They are still carrying excess. And they are still not using the distance in terms of cost.
Mazi.
What I'm saying is this. The government said there should not be excess passengers in the car. But up to today, the drivers are still doing that.
Okay.
Now, the job of the VIO, what I said is to come and say particulars, or for them to implement this policy the government has just raised, that this issue of contact is very, very important, because people are so reckless in terms of all this issue of contact. The hygiene aspect of it is very, very important.
Enforcement is what you're talking about.
Structure, stomach structure we are talking about, stomach infrastructure. What are our honorable members doing? Now, many of them are still at Abuja. Their constituency is still empty. They are not coming back home, even to help through this emergency borehole, for the people to wash their hands, people to make all this available food for people. Okay. Because when states start shutting down, the masses are going to suffer it.
Okay.
Which go for it.
Okay.
But I'm just telling our honorable members, whether House Assembly or National Assembly, yes, they should come back home and help. But they just have to at least help the masses.
Okay, Mazi.
Who cannot beg for the masses or for the less privileged. They should do what? Let people come there and help them. At least the orphanage, what are they doing? There are so many orphanages in this country.
Okay.
What will they do? Because if you shut down
orphanages,
the orphanage, they will suffer. What we pray it will not happen. But what happens to Nigerians that are well to do, public retail people, they should help the masses now or never.
Okay.
Thank you very much.
Thank you very much for calling in, Mazi. Mazi brought out, the line wasn't the best of lines, but he brought out two matters that I think we can address. He's always been concerned with running water to wash hands with, and the challenge of running water. Even when the Minister of Information was here, he brought it up. That the other thing that's, the new thing that he's spoken about this morning is this whole matter of people disobeying the advisory about overcrowding in buses and excess luggage. And I think he was leading on to the problem of enforcement.
Yes.
Is when government says this is the way to go, and people still carry on on their merry way. What about enforcement?
Enforcement is always going to be an issue and all that, because when people don't comply, then enforcement has to kick in at some point. The governor has said that the enforcement arm would definitely be, I like to say, activated.
A bit more
That's the word.
vigorous. Okay.
Yes, activated to carry out the recommendations, guidelines, and instructions and all that. Last weekend, when we got the no gathering for less than more than 50 people and all that, my phone was buzzing off the hook, and so was every official on our platform. People were telling us this place is crowded, this place is, and we acted on it. Every notification that we get, we send it to the proper appropriate channels to work on it and all that. We got videos back of enforcement unit going out, counting, making sure that crowds were dispersed if need be. Parties were shut down. There was a party that was supposed to, it was shut down. So we need the help of the public to bring it to our notice. And once that comes in, we act on it. I can tell you that everything we get, we definitely act on.
Okay, Bridget in Agege, good morning. Morning, Bridget. Okay, I know it's the line.
Yeah.
Bridget, good morning. Bridget, we know you're trying to reach us. I wonder if you can hear us. Bridget?
Hello.
Okay, go ahead, Bridget. Good morning.
Hello.
Good morning, Bridget. I'm trying to make contact with you. Can you speak, please? If you're watching television.
Hello. Good morning, there. Good day.
Go on, Bridget. Good morning.
Good day. Okay. Good day, Mr. Ilori and Mrs. Agolo, Dr. Agolo.
Okay.
Please, I don't know what the Nigerians are talking about. This is something that is very, very serious.
That's what we're talking about.
Matter. I don't know what Nigeria is talking about. Now, we are taking example from China, Italy, and other countries. So shut down is just the answer now.
Okay.
Shut down. Hunger cannot kill anybody. During the Biafra war, many people stayed at home for months, and they didn't eat, and they survived it. I know when you're at home, I know very well the God I'm serving, God will provide.
Okay.
This is a condition, stay at home. Supposing these ministers and governors will not come in for the past 2 weeks, we will have the number of those people that are infected by now. Look at what is happening now.
So, Bridget, what you are supporting.
That's why the virus has increased.
Okay. So, Bridget, you're advising people to stay at home.
Then everybody shut down and stay at home.
Okay.
Thank you very much.
Okay, thank you very much. I was a bit concerned there because you started off by saying, what is government saying? Because government is saying exactly what you have just said is the desirable. Government has said you stay at home. You know that. So, Bridget, you and government, shall we say, on the same page.
Yes.
You know, I was a bit concerned, what is government saying, because I thought there was a dissonance. No, there isn't.
Yes, she's right. And then Mr. Governor Babajide Sanwo-Olu of Lagos State did say that certain markets for food especially will still remain open.
Exactly.
It's just for trivial things, I should say. I think that's what I can say.
You might not be able to buy a new set of tires,
exactly.
For instance.
So you're not going anywhere anyway.
Yeah, you're not going anywhere anyway. But it's not a total, and I think government is careful to say it's not a total lockdown, as in fact, I heard some worry that uniformed officials should not take the opportunity, not that they would ever do that, to exploit the public. It's not a total lockdown. You're not going to be arrested if you're seen on the street. But then, in your own interest, you don't need to be jaywalking anywhere.
Exactly. You don't need to be.
But if you need to go, shops are open. So very much like abroad, where we had a call from Switzerland yesterday, and she was saying that the supermarkets were open, even there was a near total lockdown. The supermarkets were open, the pharmacies were open. So those two
essential services.
Essential services, exactly. Governor Sanwo-Olu was saying that we still want the essential services to be on, and I imagine that's the way it is all around the country.
Yes.
So, in everybody's best interest, certainly in the interest of the practitioner of accepting lockdown, self-isolating, certainly is in their interest, and then you're just not just helping yourself, you're helping everybody else. Yeah. But if you have to go out because man must work, let it be said.
Yes.
There's no problem. Mr. Abdullahi, good morning. Can you hear us? Mr. Abdullahi, good morning.
Good morning.
Go ahead, please.
Yes. Please, I just want to, I'm calling from Kaduna.
Yes.
I want to report a case in Kaduna State.
Okay.
The report is that there is a hospital, a specialist hospital in Kaduna, which is that's National Eye Center. Now, government has given directive that all staff should go home since Monday. But I discovered they've not been admitting patients, and there is a crowd of people, mostly from outside Kaduna, waiting to see doctors. Doctors are not seeing them, and they are not discharging them.
Okay.
So please, something needs to be done.
You're talking about
hard to get across to the governor of Kaduna State.
You're talking about the Kaduna Eye Hospital, Kaduna Eye Center. Okay.
Yes. There are crowd of patients, and they are not admitted.
Neither are they discharging.
Yes.
Thank you very much for calling in, Mr. Abdullahi. We have heard, as they are hearing in Kaduna, what you are saying. It's important, but I'll just get Dr. Aguro's comment on that. But be rest assured that the authorities in Kaduna have heard this report that you have made about the Kaduna Eye Center. Now, he alleges that they're not discharging anybody, they're not admitting anybody, and the more worrying thing to him is there seems to be a crowd, or there are crowds.
He's calling from Kaduna, right?
He's calling from Kaduna. I know.
So improper for me to make a comment on that. I don't even know the situation.
We don't.
I haven't the slightest idea. And I work for Lagos State government, so I can't comment on that.
But
so,
because the program goes not just around the country, even extends out of the country, and because we're talking safety generally, and we're talking about self-isolation and social distancing, I think he was seeing that, look, and that's why I say the authorities in Kaduna are hearing this as we are hearing it as well. And so they will know what to do, and that's why I was happy that he could pinpoint the location, that the Kaduna Eye Center.
That would help.
They're not admitting, they're not discharging, and there are crowds. So why should that be? No, somebody from Governor El-Rufai's office, if not the governor himself, would have been hearing this, and
I'm sure
they will know how to swing into action. So here we are. It's very important you've said that we not panic, but that we are very attentive.
Yes.
Junaid, if I heard that right, Mr. Junaid in Oshobo. Yeah, Mr. Junaid, I'm going to try not to do that again. They say, don't take your hand to your face. Good morning, Mr. Junaid.
Hello, good morning, Uncle Yori.
Go ahead, sir.
Yeah. Thank God. I just want to quickly brief on something, or maybe if Doctor can much more explain. As we all know, Lagos State has been in the forefront in situations like this. The experience during the Ebola and the present one. I don't know the collaboration within the state the health sector with other state health departments in trying to reorientate and give them the clips of what they've done so far. Like the success stories we have so far, the two success victims carrier as it is, so that others can tailor the same pattern as it is. And the second thing is this, concerning the communication strategy we use sometimes. It might be better for let me just give it up, that when announcing situations like this, some factors need to be considered. For example, when it was initially announced a week earlier that the airport will be closed, it's like a signal to those outside that, okay, there is a window gap for them to, you understand, and you can see the aftermath of what we have. So to be more, I want the doctor to shed more light. What has been the effort with other state health departments, including the Ministry of Health, in how to control the situation? Thank you.
All right, Junaid. Actually, Dr. Agro touched on that earlier about cooperation and all of that, but he wants you to just speak on cooperation with other medical departments, facilities.
In the state or outside?
I think
outside, because
yes.
I think it's calling from.
Yes.
Like I said earlier, even way before COVID-19 came into town, I should say. Other states have written and have come to shadow, understudy what we've been doing. To the best of my knowledge, and I say that very confidently, I do not believe Lagos State has ever said no.
Yeah.
So keep coming. Let's share what we know. Let's learn from each other, basically, and we'll make a better system.
So effectively, Junaid, what you said in essence, Doctor, is that it's top-notch. Cooperation, sharing between Lagos medical facilities, and all that, and knowledge, especially top-notch.
Sharing, yes.
Desmond, good morning, sir.
Hello, good morning to you, sir.
Okay, go ahead, please.
Yeah, good morning, Doctor.
Good morning.
Thank you for coming on the show.
Thank you.
And educating us. So what I would like to ask is, so far we know that this virus mutates, you understand? And what I just want to know is, what are the type of strains that this virus has? Are there because I know viruses have the ability to mutate, their diversity and how they affect people, the different.
Okay, Desmond. Thank you very much. I don't. You might be a science student or something, but he wants you to break it down a bit, and I know we don't have the time for that. But still, you get what he's trying to say.
Yes, he's asking for how many strains that we have and all that. The best thing I can tell you is that scientists are still counting. Mm-hmm. I've heard here and there that perhaps Lagos or Nigeria has a different strain that is giving us sort of like good, mild symptoms. COVID-19 is evolving. It's not until we clear the cloud and start seeing the sunshine would we be able to take a proper inventory. The strain in China and United States might be different, but the documentation of that knowledge is yet to be published. Okay. So if I say anything before that, then I'll be saying it just based on might be.
Yeah, and you don't
want
to do that.
I don't want to do that in this time. Okay. So it's evolving, and just stay tuned. It will definitely come out.
So, but in essence, COVID-19 is COVID-19. Mm-hmm. It's going around the world.
Yes.
And for the moment, that's the most important thing.
Yes.
The strain of it, well, later on, doctors might be able to break it down.
Yes.
But the point is also made that doctors themselves are saying that we don't know. Yeah. It is continually being studied. No doubt all of this will come out in the fullness of time. Yes. But I want to thank you, Dr. Ronke Agoro, for coming along. Dr. Ronke Agoro is of the Emergency Operations Center in Lagos State. It's That's the EOC part, and she's in particular of the social mobilization and risk communications. I really was, careful to get all of that in. Thank you indeed for coming along and communicating with us, so hopefully thereby reducing risks all around. Thank you once again.
Thank you very much for having me.
Our pleasure. So that's our program. Please join us tomorrow for another edition, and do your best to stay safe in the meantime. I'm Yori Falarin. Bye-bye for now.